Hello, good morning. My name is Zach. I will be doing a presentation on the spinal cord and nervous system. So bear with me though, because I have the video up, and then I also have my PowerPoint app kind of has a guidance of what I will be discussing. Um, I didn't really have a whole lot extra to say about this because I added quite a bit of information into my PowerPoint. Um, the spinal cord is, in my opinion, is super easy to understand the pathophys and how it functions both individually and together with the rest of the body and the bodily systems. Um, we could go down the rabbit hole of what if this happens, what if this happens, what if this happens, what if this happens. All day. This could be an hour, 2, 3 hour long PowerPoint presentation and conversation, but I wanted to cover just kind of the fundamental aspects of it all and really give you the nitty gritty information about how this works. So here we go. The location of the spinal cord is what I started, and that is located throughout the body. It connects at the brain, specifically the medulla oblongata, and it extends downward or distal from the brain, parallel to the spine. So a common misinformation is that the spinal cord is actually within the vertebrae, but it's not. It's actually kind of behind it or parallel to it, depending on how you're looking at the anatomical, stature of the body, however you're looking at the body. But if you're looking at it from a side point of view, which I will have some pictures in the next slide, it's very parallel with it. And both that and the brain, is covered in this thin layer of tissue that protects it. It has cerebral spinal fluid that also kind of is a protector. And so it goes from the main stem, which the spinal cord, and it branches out into these little branches in different sections. And again, there'll be a photo to show you in the next slide. Each branch sections out in a different grouping of vertebrae. And from there, it has certain tasks and jobs to perform throughout the body. The entire system, including the brain, including the spinal cord, including all of its branches and little nerve ends, is called the central nervous system. The branches are specifically part of the peripheral nervous system, so they have a little subcategory. As mentioned, here is this slide. So as you can see, you got the brain on this left image. Spinal cord is the black one, going all the way down to the coccyx. And then on the side, you have that the vertebrae, and the primary vertebrae head is right here on the right end on this image. And that's where they all sit. And as we should all know, as you look at this right image, we have the cervical, the thoracic, the lumbar, the sacrum, and the coccyx. Those are all the sections of the spine. And as you can see in this image, as they're color-coded, that these vertebrae coincide with the nerve endings, the nerve branches coming off from the spinal cord to where they would be heading in the body. And obviously this image doesn't go all the way through, but all these nerve endings, these orange ones would be coming down from the spinal cord all the way into the tips of your hands. And it controls everything that we feel, sense, all of it. So the tissue within the spinal cord is just one of the four main. It's the nervous tissue. It's typically made up of neurons and supporting cells called neuroglia. Not a big, really good at pronouncing that word. And it's just that basic tissue that, included into that cerebral spinal fluid and the coating layer that protects it. That's everything that makes up is made up of that tissue. Functions. The primary function of the spinal cord is, as I put it, the highway, is to be the highway for information between the brain and the body to the body and vice versa. So from the body back to the brain. How this works is in every aspect. I mean, it has. I'm going to jump down a couple points here. Is it has three main groupings. You have the motor function, you have your sensory function, you have your autonomic function. And my next slide will go into this a little bit more. But each task and how the brain interprets and translates and receives and sends out information is based on what function and which group that it is trying to work with and control at that moment in time. As I'll say in the next slide, the autonomic system and autonomic function is, it's secondary. It's not a active function that the body has to think about, the brain has to think about. It's just natural. When you think about it, you don't have to think about breathing. Your body just naturally does it. So stuff like that. But the motor and sensory function is kind of that typical, you grab a hot frying pan. Well, that sensory pathway, that sensory function immediately sends from your nerve endings of your hand. And actually, it doesn't always have to go completely up to the brain. And that's the beauty of the spinal cord, is a lot of this information doesn't have to hit completely into the brain. And that's what causes that immediate reflex rather than delayed response. Because all that information does is has to travel from your hand to your spinal cord and back, telling your body going, no, that's hot, don't touch it, that's dangerous. That is a danger, it could hurt us. And we let go. But it's a 2-in-1 system. So yeah, and it works extremely quickly. So, you have that sensory pathway that immediately sends from your hand to your spinal cord and brain, this is hot, and an immediate response, a secondary pathway, the motor pathway, is then sent back saying, let go. So it's a very amazingly simplistic almost system, but it controls everything. It's common sense. It's stuff that even when we're not thinking about it, we're thinking about it. Our brain knows. So it does control everything, that from walking to talking, to all that. And I have that in the next slide, but it controls things that we don't even give a second thought to as well. So here they are separately. Motor functions is the area in charge of directing the body's voluntary muscle movement. As I give examples, walking, jumping, twerking. It's everything, You decide you want to start snapping your fingers, that's your brain. I get up to go get a glass of water, it's my brain, it's telling me. And I'm having a thought in my mind saying, hey, I need to get up and go get a glass of water. My body is what is controlling that. I mean, it's controlling everything I do right now with my hands, my mouth, all of it. Sensory function is the area that monitors the sensation of touch, pressure, temperature, and pain. And like I just said, the hot pain. You have the cold snow. For us in Colorado, we understand this. Grab snow, it hurts with your bare hands. Everything's down to a paper cut. Every small little scratch and bruise that you get, your body senses because of the sensory functions of the nervous system. And then, like I said, the autonomic function, this is the area that functions to regulate digestion, urine, body temperature, heart rate, dilation, and contraction of blood vessels, which really that just means your blood pressure. So it controls everything we do. I mean, it controls your heart rate, like it says. It's what controls your heart beating. Now, the heart itself has its own system of operation, which is the electrical currents and all the nodes, but I'm not discussing that today. But it controls everything. Your digestion, your intestines are constantly moving, and they're regulating. They're pushing everything through, and that is part of your brain's ability to control that. And the beauty of all these systems that I'm mentioning, the digestive system, the urination, the body regulation, the heartbeat, and the blood pressure, these are all things that are assisted and slightly controlled by the nervous system for the most part, but they also have their own separate kind of pathophys, their own separate functioning system. So there are other factors that affect them that aren't directly correlated to the brain or the spinal cord. And I'll stick with that example of the heart. electrical current. So the heart has an electrical current constantly pulsating through it from the SA node to the AV node to the Purkinje fibers. And these, that's just how it works. And that's what, makes it say, okay, I need to contract the atriums, and then I need to decontract the atriums, and then contract the ventricles, and how it pushes all that out and in. And the brain is part of that process, but it's the heart's job. But if something goes wrong there, and let's say there is a misfire of the electrical current, a constant misfire of the electrical current, or too quick of a fire of the electrical current, which is commonly seen in a condition called atrial fibrillation, the brain will find out about it because it senses it. So it has that sensory pathway still, where it's going, this isn't right. And it sends a message from this area up to the brain saying, hey, something's not right. And the body responds accordingly with signs and symptoms, such as, getting pale, short of breath, diaphoretic or sweaty. So that's how the body responds. So although the brain's not the one that's controlling that necessarily for that first initial problem with the heart, but it is part of the homeostasis, which I will be going into here next. Homeostasis of the spinal cord, I find it extremely interesting. I think it's quite interesting to discuss, and to a certain degree a little difficult because, like I was just saying, the homeostasis of the CNS, the central nervous system, has its own, but it is also part of the homeostasis of the entire body as well. Everything is part of the spinal cord and the brain and the nervous system. There's nothing that doesn't go through that pathway in some degree, which makes it interesting because you have the primary nervous system, but one could argue if everything's affected by it, why isn't everything part of the nervous system? But it has its own homeostasis and controlled environment it needs to maintain, specifically in the brain, the spinal cord, and the branches. And when those are affected, it affects them directly, but it can also be affected by the homeostasis of another organ system, or vice versa. That organ system's homeostasis could be affected by the homeostasis of the spinal cord. It's a balancing game, and it's with the spinal cord and the nervous system, it's a big balancing system. It's not just one organ system. One I like to give an example of is your appendix. No one knows really what the appendix is for. You get appendicitis, then your appendix ruptures. You get it taken out. You can get it taken out even if everything's fine. You might have to convince the doctor why, but you could. And your body's fine. There's no change in the body's homeostasis with that organ removed. So, if my appendix gets stabbed, let's say I get stabbed, okay? I'm going to give this example. I get stabbed in my lower right quadrant of my abdomen. My appendix is, skipping all the homeostasis factors involving the penetrating trauma. So now my skin, my muscles, my tendons, all those are affected, yes. But let's just talk about the organ in itself. You puncture my appendix. Now, the only big problem there is I have a ruptured appendix. I have a penetrated appendix, so that does need to be removed, or it will affect the body. What I'm saying, though, is it doesn't affect my stomach, my digestive system. It doesn't affect my muscular system. It doesn't affect my respiratory system, or my endocrine system. It doesn't affect any of those. It affects the direct system it's part of, or that area surrounding it. And the parts that would affect the rest of my body would be that, trauma, the bleeding, the, hypovolemia, potential hypovolemia, I should say. Those would be the same things you see. but it wouldn't be directly correlated to the appendix. And once I go into surgery and get that removed, all is fine, well and good. The only risk I have now is healing from the surgery, from the knife wound, not from the removal of the appendix. You can't say that about the spinal cord and the nervous system. If you affect that, if that is damaged, if that is diseased, it's going to affect everything, because the spinal cord affects everything. It affects everything from the way your hands move to the way I'm breathing and what my heart rate is right now. Just like any real bodily systems, there's two main things that can affect it, which is trauma or disease. The interesting thing about the spinal cord is, depending on both the location and the severity of either one or both of these factors, will determine the extent of the damage to the homeostasis of the spinal cord. So location is a huge factor, and then of course severity of, okay, what exactly happened and how bad is it? Is it I fractured a vertebrae and it's causing compression, and now I'm having a lack of sensation? Or is it like a complete sever spinal cord, and then it's like, okay, well, now I've lost complete mobility. I started talking about trauma here specifically. Example I gave is a car accident. I'm going to use the term MVA. That just means motor vehicle accident. And like I was just saying, depending on the problem, it can range from a full recovery to a mild loss of sensation and movement to complete and full paralysis and loss of control of that area below the injury. The example I gave is an injured spinal cord in an MVA, severed cord at L5, your fifth lumbar. The body will be unable to maintain any homeostasis or control or function below that injury site. Now, of course, again, that severity talk, even if it's severed, there is possibility of recovery or some recovery. But let's just stick with there's complete severed vertebrae and spinal cord at L5. There's no function. What that is it's gone. That, you have the highway and you just cut that out. There's no way it can continue. So it has no ability to control the sensory or motor pathway between anything below that, which, as you know, your L5 is probably a little just below midway down your back. It's pretty much right where it curves. So if you can have a little picture in your mind of, here's your cervical and it arcs like this, and this is all your thoracic right here. Your lumbar, L5, is probably about right here, right in the middle of that curvature, inward curvature that you typically see in a spine. So it's going to be everything below that, which is your entire lower body, your legs, everything. Signs and symptoms regarding lack of homeostasis there would be the little to no mobility or sensation of your lower extremities. So you want to be able to feel or move your legs. And then you have no control of your bowels or bladder. So now this damage, this trauma to your spinal cord has now caused a lack of homeostasis, a lack of function, proper function in both, the sensory and motor pathways of the extremities, but it's also affected the bladder, the urinary system, and your bowels. So now your GI system. So, of course, there's treatment for that. You can put a catheter in that kind of helps maintain the general function, but it's not the same of what it's like. If I drink 5 glasses of water, my body's going to tell me when I need to go to the bathroom. It's not the same way. If I didn't get the equipment necessary to keep a somewhat normal function of that system, it would be a mess. And that can lead on to a rabbit hole of other problems. You have no mobility or sensation down there, and therefore you're going to be in a wheelchair, obviously. And let's say you get a burn on your leg. You burn your leg, 3rd-degree burn on your leg. Well, you can't feel that. So unless you know about it and then you do the proper thing and go get care for it, you're not going to, be able to do anything or feel anything, and your body's not going to be able to tell you, hey, something's wrong. And then that festers and it gets infected, and your body still can't say, hey, something's wrong. So the next thing you know, your body's septic because it's finding an infection that it doesn't know it has because the response time was too late. So now you won't know that there's something severe going on till you're septic and your body's about to shut down. Um, and of course, if you catch the sepsis early, good, that's great. Catch it too late, and then you got multi-organ failure. So depending on how well you take care of yourself, so it definitely leads to a far greater need to be very self-aware of your body in those areas to avoid further problems that are secondary to this injury. Not including just day-to-day stuff like how do I use the restroom. And again, the concept's the same no matter where the location of the injury is. The only thing that changes is where the injury is located. So I went pretty low there. An L5 fracture is actually severed, is one of the most common. That and a cervical severed spinal cord. So you're talking C4, C5 right up here. That's another very common one, and that one is very severe. So you have a fracture up here that's severed. You get in a car accident and it severs the spinal cord up here. You lose function of everything below it. So now you can't control the autonomic system that is part of that, which includes your heart, your breathing. So you have to be regulated for all of that. You need help breathing. You need help controlling your heart rate and your blood pressure. It's a lot of machines. It's a lot of medications. So it becomes very difficult. And then, it's a very huge change in the quality of life that you have. So the concept's the same, though. Where you're being injured determines what's affected. And obviously with the spinal cord, the higher you go, the more systems are going to be involved there. The respiratory system, the cardiovascular system, all those will be affected if you're injured here, but they won't be if you're injured, L5. Next one I'm going into is in terms of disease. Again, I actually consider this one a more accurate representation. I guess accurate is probably not the most correct word in this. I would say better representation of the homeostasis of the spinal cord specifically, but also that slow ongoing effect of the homeostasis of the rest of the body. So with trauma, it's almost immediate. You sever the spinal cord, done, over with. It's ruined. With disease, depending on the disease, it affects the homeostasis of a lot of things, but in a very slow, progressive way for a lot of them. There's a multitude of diseases that affect the spinal cord. It could be a cancerous tumor. It could be a non-cancerous tumor. It could be a benign tumor, but a tumor nonetheless. You could look at a disease such as meningitis, which is a very common one that people hear about. Or you could look at a degenerative disease such as spinal muscular atrophy, which is just, as the name says, atrophy of the muscles around the spine and within the spine. Everything all those muscles muscular fibers connecting near the spine, atrophy. You also have something like MS, multiple sclerosis, which I take, personally. My grandpa has that, so I actually get to see that, in person on how it affects somebody on a day-to-day. But the example I decided to go with is meningitis. The disease is characterized by inflammation of a thin tissue that surrounds the brain and spine called the meninge. The severity of this is all based on what type, and if you take proper care of yourself and go get proper care. There's two types. There's viral and bacterial, and the severity of and risk of death depend on, again, which type you have. Bacterial is far more severe than viral. Viral is far more common, but it could be the bacterial, and then you've got to look at, okay, what are you doing to take care of yourself? The most common signs and symptoms of viral meningitis are, a stiff neck, a sudden headache, a new onset of a fever, and nausea, vomiting. I mean, very, very mild signs and symptoms. Besides the stiff neck, it sounds very similar to a flu. Which nowadays you could say this sounds very similar to COVID-19, which is mistaken for the flu all the time. I see it every day with my job. But the stiff neck is the key one that you want to look at as a medical professional when you're trying to determine a disease. You got to look for common signs and symptoms, but you also need to find a key outside sign or symptom that distinguishes it between other conditions. And that stiff neck is a huge one. That is a key thing. If anyone comes to me and calls 911 and I show up and they're just like, hey, I've been having a headache, I've been nauseous, I've been vomiting, I have a fever of like 103. Like, okay, well, you probably have the flu. I might tell somebody, if they're having some respiratory conditions, they might have COVID-19 right now. But if they're like, yeah, my neck's been really stiff, meningitis is where my mind's going to go. So it's stuff like that you got to look for. Next slide. Oops, sorry. So it's one of those things that it's affecting the rest of the body. Sorry, I meant to continue with this. It's affecting the rest of the body. Now it's mostly affecting the spinal cord. It's that inflammation. And it's a slow going. But once that inflammation and that condition remains for a certain extended period of time, it finally hits that point of, okay, my body can't handle this anymore. My body needs help. So then it sends out those signs and symptoms to tell the rest of your body, hey, something's not right. Where you get the headache and the high fever and the nausea, vomiting. Well, now you have a homeostasis being affected in, let's say, nausea, vomiting, the GI tract. Okay, the fever is controlled by the autonomic nervous system. So the nervous system in another section is being affected. Headache, same thing, kind of just of a sensory pathway being affected in the nervous system. So this disease I chose because, like I said, it's a better accurate representation of how it affects these nervous systems specifically, but in some small ways it does affect other systems still. So it's very interesting to see how much and to certain degrees the nervous system affects the homeostasis of the entire body. All right. In conclusion, the spinal cord, it's extremely fascinating. I mean, it's the entire nervous system is amazing. I would not say it'd be an exaggeration to say that without this vital piece of of the body, of the system, we wouldn't be able to function. I mean, it's literally the highway of all information received, processed, and returned. It's a complex system, but also very simplistic. It's simplistic in how it acts. Receive information at point A, sends that information to point B then translate that information and sends it back to point A. Is the day-to-day typical way the nervous system behaves. But it's so complex as well because then you're getting into the other tasks that the nervous system performs that we don't even think about. The autonomic system of controlling our blood pressure, controlling our heart rate, controlling our respiratory rate. All of that. And how we function every day at a homeostasis at a controlled, comfortable level because our brain's just doing all that work without us even having to think about it. Um, but even more than that, of how much it influences the other bodily systems, and helps maintain and control the homeostasis of those systems as well. Um, and just like any part of the body, disease and trauma will impact it and the effectiveness of the spinal cord, and in turn the rest of the body, like mentioned in the trauma with the severed L5 location. I mean, it's a key component of the body and the bodily systems, and not just with the nervous system. It controls so much. So it's super fascinating, and if there's any information that I haven't provided, um, I would urge you to absolutely do more research. I mean, maybe you can go far more down the rabbit hole than I did, because I spent hours down the rabbit hole and determining what information was worth having and what information wasn't. Like, is this secondary to this, or is this really what I need to tell these people as a new student coming in? What do you need to know? And so it's definitely something you can absolutely go on and find more and more information, study every disease, study every type of trauma, study all this stuff, and the pathophys of how it affects the nervous system, and in hand the other bodily systems. So if you found this fascinating, I definitely urge you to continue figure out more information. Thank you.